Hi everyone, today my group will present our analytical report, which is the title is Obesity and Lifestyle Choice in Malaysia. So this is our group members: Nurul Nurliana binti Ahmad Nur Azam, Nurul Nur Safina binti Ahmad Nur Azam, Nurul Shikin binti Muhammad, Ani Yulia binti Muhammad Afandi, and me myself, Nadia Batrisha binti Mahisen.
Let's begin by understanding the background of the problem. According to the NHMS 2019, over 50% of Malaysian adults are classified as overweight or obese. This alarming statistic is driven by rapid urbanization, which has led to increased consumption of fast food and more sedentary lifestyle. Obesity, as we all see, is a major risk factor for non-communicable disease, making it a pressing public health issue. Furthermore, the economic impact on the healthcare system is immense, costing billions annually. But this issue is not just about numbers. It's about the quality of life for millions of Malaysians who are at risk of developing serious health problems like diabetes and heart disease. It's about the societal and cultural shift that has made unhealthy lifestyle the norm. By the end of this presentation, I hope we all have a clearer picture of how we can play a part in tackling this issue. The primary purpose of our report is to analyze the prevalence and causes of obesity in Malaysia. We aim to provide actionable recommendations to address this issue, raise awareness about its health and economic impact, and evaluate current policy for their effectiveness. This report serves as a call to action for stakeholders, from policymakers to individuals, to take decisive steps to combat the obesity crisis. By understanding the root cause, we can develop targeted intervention. Moreover, this report highlights global best practices that could inspire local strategies. For instance, countries like Japan have implemented successful workplace wellness programs. How we can adapt such ideas to suit our unique cultural and socio-economic context. This report seeks to explore these possibilities. For our investigation, we employed a quantitative research design using a Malay translated mindful eating questionnaire. We surveyed 150 respondents aged 18 to 15 from urban to suburban areas. The data were analyzed using SPSS software to identify key trends and correlation. This method ensured a diverse and representative sample for our study. Additionally, secondary data sources were used to compare our findings with national trends. Conducting this research was not without its challenges. We faced difficulties in reaching certain demographics, such as older individuals who might have less access to the digital platform we use for surveys. However, by using diverse locations such as shopping mall and fitness center, we managed to gather a comprehensive dataset.
This slide provides an overview of the prevalence of obesity, highlighting the key statistic factors contributing to the issue and potential solutions. Next is overweight and obesity rates. Currently, 45% of the individuals are either overweight or obese, with the highest prevalence observed among those aged 30 to 40 years. Additionally, women tend to have slightly higher obesity rates compared to men. Rising obesity in younger population. An increasing concern is the rise in obesity among children and teenagers, driven by the consumption of unhealthy snack and sugary beverage. This habit lead to serious long-term health risks. The next part is gender-specific and age-target interventions. To address this issue effectively, it is important to implement gender-specific and age-target programs that cater to the specific needs of different groups. Last one is role of school. School play a significant role in preventing obesity by introducing mandatory physical activity programs and nutrition workshops, which can promote healthier lifestyle among students. This slide focuses on dietary habits and their role in unhealthy eating patterns, obesity, and potential solution. Firstly, we see that unhealthy eating patterns like frequent fast food consumption, more than 3 times a week for 60% people, and a regular intake of sugary drinks by 75% are significant contributors to poor health. The causes behind these habits include the convenience and affordability of unhealthy food options, as well as a lack of awareness about balanced diets. This habit lead to high calorie consumption with fast food meals containing over 1,000 calories, resulting in weight gain and poor health outcomes, including obesity. To address this issue, the slide highlights some key solutions such as promoting portion control and balanced meals, educating people about healthy eating habits, and regulating food marketing, especially for children. Overall, it stresses the importance of tackling unhealthy eating habits to combat obesity effectively. This slide focuses on physical activity levels and the factors influencing them. First, we observe that sedentary lifestyle are prevalent, with only 30% of respondents meeting the World Health Organization recommended physical activity levels. Additionally, 70% of people face barriers such as lack of time, motivation, and access to facilities, which further discourages active living. Urban design also plays a significant role. Many urban areas lack infrastructure like pedestrian-friendly sidewalk, park, and cycling lanes, making outdoor activities less appealing. This highlights the importance of urban planning in promoting active lifestyle. To address these challenges, the slide outlines recommendations such as introducing workplace fitness initiative and community exercise program, subsidizing gym membership, and offering fitness taxes incentive could also encourage participation. Finally, there are success stories where some communities have implemented working groups and weekend events, resulting in higher participation rates and better health outcomes. These examples show the positive impact of targeted interventions.
This graph highlights the level of awareness about recommended calorie intake among respondents. As shown, a significant majority, over 18 respondents, are aware of the recommended calorie intake. However, there is still a notable portion, around 60 respondents, who are unaware. This indicates that while awareness efforts have reached many people, there is still a need for broader education on calorie intake guidelines to ensure a healthy lifestyle. The second graph explores obesity rates across different income levels. We observe that the middle income group has the highest number of obese individuals, with about 50 respondents falling into this category. The high-income group follows, while the low-income group shows the lowest obesity rates. This trend could be due to varying access to healthy food options, lifestyle choices, or level of physical activity across these income groups. These insights suggest the importance of targeted interventions, especially for middle-income earners, to address and manage obesity rates effectively.
Assalamualaikum. My name is Nurul Shafina binti Amanul Azam. My ID number is 2021257282. This one is about psychological and cultural factor. Okay, let me explain. The psychological impact of obesity cannot be overlooked. Around 50% of respondents reported low self-esteem and 30% admitted to emotional eating. Cultural norms also play a role, with high-calorie food often consumed during social gathering. Okay, addressing their factor require a holistic approach that include mental health, support, and culturally sensitive intervention. Okay, for example, we can introduce healthy version of traditional dish during fest season could promote a balance between culture prevention and health. Encourage open conversation about mental health and its connection to eating habit. It's also vital to breaking the cycle of emotional eating. And community-based also support group can provide safe space for individuals to share their struggle and learn coping strategy. Okay, environment barriers. Environment factor, mental factor, such as the lack of pedestrian friendly infrastructure and recreational space hinder physical activity. Urban areas productive vehicle over pedestrians and issue like a poor air quality and extreme weather factor discourage outdoor activity. Improving urban planning is critical to fostering an activity lifestyle. Imagine neighborhood with a accessible park, well-lit walking paths and fitness station. Such environment naturally encourage residents and to stay active. Okay, for government can collaborate with an urban plan to design cities that promote physical activity as a norm. And moreover, initiative like a car-free zone and on weekend or public fitness challenge can speak community engagement in physical activity. Okay, for the next, I will explain about our video influences. Okay, video can play a powerful role in shaping perception of obesity. Our survey found that motivation and workout video had a most positive impact, while influencer content was less effective. Public health should encourage social media to share reliable and engage video content more that inspire healthy lifestyle. Okay, for instance, a video showcasing a local success story, someone who transformed their healthy through better life choice, can inspire others to follow suit. This video should be relatable and offer practical tips that viewers can implement immediately. Additional collaboration with well-known fitness influencers who advocate for sustainable practice can amplify this message.
Assalamualaikum. My name is Nurul Liana binti Amanur Azam and my student ID is 2021360287. In conclusion, obesity poses significant health and economic challenges for Malaysia. Tackling this issue requires collaboration among individuals, community, and policymakers. Immediate action is essential to reduce obesity rates and promote a culture of health and awareness. With targeted interventions, we can improve public health outcomes and alleviate the financial strain on our healthcare system. Let's remember that this isn't just a health issue, it's a societal challenge that affects everyone. Together, we can make a difference. Through coordinated efforts and shared commitment to healthier lifestyle, we can create a better future for all Malaysians. To combat obesity, we recommend public health campaigns promoting mindful eating and regular exercise. Policy measures like sugar taxes and food subsidy can encourage healthier choices. Additionally, improving urban infrastructure and community initiatives can foster active lifestyle. Healthcare providers and workplaces also play a vital role in this effort by offering wellness programs and nutritional counseling. Further research into culturally specific causes of obesity can also help refine strategy and interventions. By working together, we can apply this recommendation and create a healthier, more resilient Malaysia. Encourage Encouraging cross-sector partnership will ensure the sustainability of this initiative. Thank you for your attention. We now like to open the floor for any question or discussion. Together, we can work towards a healthier Malaysia. Let's collaborate and take the necessary steps to tackle this pressing issue effectively. Your insight and suggestions are highly valued, and I look forward to a productive discussion.